Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. Our topic this episode, Understanding Diabetes, and my guest, Venessa Paddy, nurse practitioner and manager of disease management with Heart Memorial Health. Thanks for being here, Venessa.
Thanks for having me.
You know, a lot of Kentuckians unfortunately have diabetes, and it affects individuals of all ages. We hear terms such as pancreas, blood glucose, insulin. How does diabetes affect our body?
There's usually two characteristics that are present in the body when you have diabetes. One of those is your body doesn't make a sufficient amount of insulin, and that's where pancreas comes in, because the pancreas is the organ of the body, sits behind the stomach, and it's the organ that manufactures insulin. Insulin is a vital hormone to the body in so much that it helps our body use sugar as a fuel source. Which is what we want it to do. So if you don't make enough insulin, then your body is going to have an excessive amount of sugar, which in fact is damaging to the body. The second component is insulin resistance. And insulin resistance derives from a lot of studies show the fat that we carry in our abdomen, that particular type of fat, as opposed to what's on our legs and our arms, tends to release some hormones that actually oppose the effects of insulin, and so it causes resistance. So we may make insulin, but when the insulin tries to do its job all the way down at the cellular level, it can't do it. So when we see people with diabetes, they either have one or both of those conditions, and it varies, depends on what type of diabetes that you have.
Now we know, we hear too, I guess, and we also know that food gives us energy, and that is a big part of diabetes too, correct?
Correct. Your primary fuel source for your body comes from carbohydrate intake. So carbohydrates are in essentially everything except meat. So all your fruits and vegetables and your grains, pastas, and rices. However, they vary by the amount. You have starchy vegetables like potatoes and corn and peas, and non-starchy vegetables such as broccoli, carrots, and green beans. So there's a difference in the amount of carbohydrates in those foods, the starchy having quite a bit more than non-starchy. But regardless of that, when carbohydrates are taken in the body, they're broken down into the simplest fuel source, and that's sugar, and that's what our body uses. We call it glucose, but that is the primary fuel source. Not that the body doesn't have backup. There are other fuel sources in the body, but we really want our body to use sugar. So it's not an evil thing, even in people with diabetes. So what we do is we teach people to control their carbohydrate intake through their diet to help control their glucose levels. So we teach portion control. We don't ban any particular foods, maybe sugary drinks. We don't like sugary drinks. But we allow people to eat the right foods, healthy food choices in the right quantities so they can control their blood sugar.
Well, perfect. And we also hear about different types of diabetes. Type 1, type 2, gestational. Tell us a little bit about the differences between those different types.
The easiest one to tell you, just real quickly, is gestational diabetes, and we associate this as occurring during pregnancy. It's typical to have a mother who doesn't have diabetes, that didn't have diabetes pre-conception, but during the pregnancy, her glucose levels start to rise, and we detect what we call gestational diabetes. That occurs because of hormones that are generated from the placenta, and so it causes the glucose level to rise. This can be very dangerous if it's left uncontrolled for both mom and the baby. Can cause birth defects, can cause difficulty during delivery, very large babies. Those types of things can occur with gestational diabetes. So during that time frame, very strict diet, some medications are used to control the glucose. So this is why we do glucose tolerance tests during pregnancy to screen for this. The other two types of diabetes that the majority of people out there walking around in our community with are either type 1 or type 2. Now, type 1 diabetes is only about 10% of the diabetes population itself. In this situation, the pancreas has shut off the manufacturing of insulin. Most people, it occurs as kind of an autoimmune disorder, so the body attacks its own insulin-producing cells in the pancreas, so it stops making insulin. And because of that, the individual is required to take insulin in order to sustain their life. Because without insulin, I can't use sugar, and I need that for my fuel source. So only about 10% of the patient population. Now, diet is important for those patients, as well as exercise. Very important for even type 1 diabetics as well. Now, type 2, the more predominant form of diabetes, 90% of the people out there, type 2 diabetes, this is the condition where there's generally the combination of no insulin and insulin resistance. And the resistance comes from obesity. So we see a very large trend of type 2 diabetes among people who are overweight. There is a strong familial link, so genetics do have some component to it, it seems. Their diet is a big factor in it. Exercise, sedentary lifestyle is a factor. So this is the one that we see more common out there with older adults, the development, but I'd be remiss not to say that it's happening among children as well. We're finding that it used to be, the old way of thinking that is if it was a child with diabetes, it was always type 1. And an adult always had type 2. But today we're finding more and more children developing type 2 because obesity rates in children are just skyrocketing from their sedentary lifestyle and those types of things.
So listening to that, I think, the type 1, you said the 90% or more type 2, boy, as our listeners, view this, they really need to think about what they can do to hopefully take some steps. So obviously maintaining their weight, exercising, making good food choices. What are some other things we can do to prevent?
Well, there's lots of diabetes prevention strategies, and weight is a major factor. Smoking cessation, believe it or not, because nicotine has been shown to have an effect on how insulin works in the body, a negative effect, we'll say. So that's very important. Having an active lifestyle, being, you don't have to necessarily go to the gym, but you don't want to be sitting on your couch all the time. Those types of things are going to promote overall health. Weight is a major factor. So there's lots that people can do for prevention. Now, there's some things that we know make you more at risk. It's more predominant in African American population, for example. You can't change that. So you want to stay ahead of it and know that you are at risk, and keep those things in check. Take your medications, see your doctor on a regular basis, and diet is a major component to that.
So probably some basic numbers that individuals would need to know is their weight, maybe their body mass index, and then their blood glucose level. When should someone be checked for maybe a risk for diabetes?
Well, it's really going to kind of vary based on those risk factors that they have. So, if you have a family member, a parent, a sibling with diabetes, then obviously you would want to get checked sooner rather than later, because you are at great risk because of the familial link. An otherwise healthy person at their recommended body weight, who's physically active, they're just going to get their regular health exams every year and shouldn't have to have any additional screening for those types of things. So it really varies on your risk factors. If you have coronary artery disease, if you have high blood pressure, then that would make you more prone to also being positive for diabetes or at risk for diabetes. So it really depends on those factors.
And I think, too, if they have that established relationship with their healthcare provider, they can discuss all those, background, your history, your personal lifestyle that you have. So, really open that conversation with your healthcare professional and, see if it's something that you need to actually be tested for.
We also tell people there are some common symptoms that an individual will experience when they develop diabetes. Some more than others, so it varies from person to person. We find people who are complaining of really unexplained fatigue. They're just really, really tired. They cannot explain why they're so tired. Maybe they're having some blurry vision issues, excessive urination, excessive thirst, excessive hunger, unexplained weight loss. These are all symptoms of diabetes, so we do urge people, if you find yourself or your loved one or your child experiencing these types of symptoms, then you need to make contact with your physician or your primary care provider so that you can have a simple blood test just to see what your glucose level is.
Absolutely. Now, we've heard a term, too, called prediabetes. I think in the past you used to hear you either had, diabetes or you didn't, but we're really hearing this term prediabetes. Can you tell us a little bit more about what defines a prediabetes?
Well, there's lots of terms that are used to refer to prediabetes. Some people will say they have borderline diabetes. We hear people say they have just a touch of sugar. Some doctors will diagnose what we call impaired fasting glucose or impaired glucose tolerance. All of these terms kind of fall under the net of prediabetes. Prediabetes means that when we've done your blood work, your glucose level, and there are other tests as well, is not quite high enough to meet the diagnostic criteria for diabetes. You have to have a fasting glucose of greater than 125 to be diagnosed with diabetes, and generally on more than one occasion, or a random blood sugar. I mean, they take your blood sugar at any time of day of greater than 200 with symptoms of diabetes like those I just described to be diagnosed with diabetes. Well, normal blood sugar should be less than 100. So if you fell in an area between 100 and 125 on a fasting glucose, like a 111, a 107, then we tend to put you in a prediabetes category. Now, what that means to you is that you are at risk for developing type 2 diabetes later in life. What we find is about 50% of the people out there who fall in that prediabetes category go on to develop type 2 diabetes later. The remainder of those, some of those will resolve it, or some of them will just remain in this prediabetes range for the remainder of their life. So what we do when we have somebody who is in this prediabetes range is we target strategies to eliminate the risk of developing type 2. And the number one strategy is weight loss. Surprisingly, losing 5 to 7% of your current body weight can reverse it in some circumstances. Remember, there's a small population that it won't go away, okay? We also encourage blood pressure control, smoking cessation, and increased physical activity among those patients, too, to reduce that risk. But, if you put it in perspective, if I weigh 200 pounds, all I need to do is lose 10 pounds, and I may reduce that risk. So we really counsel and coach individuals on proper dietary choices, healthy food choices, and exercise.
So it sounds to me we're really seeing this link between obesity and diabetes
Exactly.
as far as a great risk. So, that's something that we can empower ourselves to try to take control over. It's difficult to do, but learning new lifestyle habits and having those become something that you do on a continual basis to reduce your risk. Now, too, I heard you say fasting. That really means not having anything to eat or drink before you have that lab level drawn. So we'd want that to be below 100. Is that correct?
That's a normal glucose, between 80 and 100.
Okay.
And fasting should be 8 to 10 hours at least. I really would rather push it back a little bit longer just to make sure. And generally that's the case when you're looking at, cholesterol levels and those types of things as well. So.
Now, you also said there were other tests.
Yes.
And I think one of the other things we're hearing about is A1C.
Yes.
Tell us a little bit of difference between the A1C and a blood glucose level.
Well, glucose level actually measures the amount of sugar in your blood. Okay, so it's a direct measurement of that. The A1C, your red blood cells in your body have hemoglobin on them. And the hemoglobin is what carries lots of important things like oxygen and iron and things like that. And it also carries sugar. The more sugar you carry, the more residue you leave on that red blood cell. And when we do a hemoglobin A1C, we're measuring what percentage of that cell has a residue of sugar left behind on it. So a normal A1C, the upper limit is like 5.7. So anytime your A1C is above that, you've been carrying some extra sugar. And it's for an extended period of time because our body, the perfect machine that it can be, recycles our red blood cells about every 120 days. So when we do an A1C, it actually kind of reflects what your sugar has been for that last 3 to 4 months. So when we get a result from an A1C, about 50% of that result can be attributed to the last month, and the rest of it comes from those 2 or 3 months prior to that. So when we get an A1C and we look at that and it's above normal, we begin to think, is this pre-diabetes, is it diabetes? So if it's above 5.7 but less than 6.5, that's pre-diabetes. 6.5 or above, that's a diagnosis of diabetes. And this kind of is very helpful for us because a lot of people, you know, they don't want to get diagnosed with diabetes.
No.
You know, it's a chronic health condition. There's no cure for it. We control it. So they see this random blood sugar or this fasting blood sugar of 130, and they're like, oh no, there's no way I could have diabetes. I ate birthday cake yesterday. And that's not the case. That doesn't do it. So the doctor will order the A1C, and then we see, well, yes, indeed, your A1C is 7 or above the 6.5, and that really confirms that the sugar has been elevated for an extended period of time. So, yes, indeed, it is diabetes.
So it sounds to me like when you said the blood glucose levels, a little bit more of a snapshot at that time, you know, that moment in time, and then that A1C is really reflecting back on a history.
Exactly.
So does everyone get an A1C, or it's when you talk to your, you know, practitioner, you kind of make that decision?
It's not always a routine test.
It's not, okay.
Now, if the physician orders your lab work, it's very common to get a glucose when they do chemistries and things on a person. And if they see a suspicious glucose, then they'll order an A1C as a separate test. If you have diabetes or you have prediabetes, then the provider would order that on a routine basis. When we have patients diagnosed with diabetes, this is the test we do every 3 to 6 months. Depends on how stable you are. If your blood sugar's in really good control and your A1C's at target, then twice a year is sufficient for that. But otherwise, we do it quarterly.
Perfect. Now, there are a lot of new medications that are out there on the market to kind of, I guess, enhance or help with some of the insulin. Tell us a little bit about how they're working, and they may not be for everyone. That's something, obviously, that you talk to your healthcare professional about, too.
Well, of course, you know, we've had insulin for years, but now we have fancier insulin. You know, I've been a nurse for 30 years. Don't tell anybody.
You must have been 15 when you started.
Yes, that's what it was. And, you know, we just had a couple simple insulins that we could give to patients. And today there's a list this long of insulins that are very unique in how they function in the body to mimic and actually work almost just like the human body's insulin. So it's really fantastic where we've come with insulin that you can take once a day. So that's always, you know, a predominant treatment therapy, but there's also new injectable medications. You've probably heard of Victoza, Trulicity, these types of drugs that are out there now, Byetta, Bydureon. There's a long list of these drugs that are also injectable that are really unique in how they help our body to make more insulin, make less sugar, to control our appetite. So it's pretty incredible. And then the list of oral meds has just exploded with new drugs that are out there on the market today. You know, we used to think many, many years ago that diabetes was exclusively a disorder of the pancreas. But what we've learned is that there's a whole lot more going on with glucose control than just the pancreas. The liver stores sugar for us, so we have it available in between meals. So we have medications that can target the liver releasing sugar in a proper manner and not releasing it when it's not needed. We found that there are hormones that are actually from the gut. When we eat, they are released, and they tell us when we get full. They tell us how much insulin we should make. They tell the liver, don't make any sugar, because they're eating sugar right now. And they're really fascinating. So we have a whole class of drugs that target the gut hormones to make our body control glucose better. So it's really very, very fascinating what's available out there today.
You know, we live in just a very accelerated time, I think, of a lot of different discoveries with medicine in general. So how lucky we are that all these different developments are coming about, because individuals are able to lead a very active life, with
Absolutely.
diabetes. And that being said, what tips do we have for our individuals that might have diabetes, or if they know someone that has diabetes, as far as living a healthy lifestyle? What steps can they take? I know you had mentioned portion control earlier. What are some other things?
Being physically active, and from a diabetes standpoint, 30 minutes daily of sustained activity, moderate activity, is what we recommend. At least 5 days a week, no more than 2 days apart in your activity is important. And I can't say it enough, smoking cessation is very important, because we know diabetes increases your risk for cardiovascular disease like heart attacks and strokes, so smoking does that as well, so eliminate that. Monitoring, we encourage patients to monitor their glucose levels on a regular daily basis, so that they can be in charge, so that they know that the effort they're putting in, the medications they're taking, the dietary control, the physical activity is actually having a positive impact on their blood sugars. So we strongly encourage patients to monitor their glucose levels. And then just kind of complication avoidance, seeing your doctor on a regular basis, making sure that you're getting eye exams every year, to make sure there's no damage to your eyes from diabetes, getting your feet examined to make sure that there's no issues with your nerves or anything in your feet. So there's a lot of health maintenance that a person with diabetes needs to do. And then certainly compliance with your medications.
And those are good points. And when you talked about compliance with medications, it makes me think, too, that we're very fortunate at Heart Memorial to have a diabetes management program. So we have certified diabetes educators, a dietitian, a team of individuals that are there to work with someone who might have diabetes in getting educated. Tell us a little bit more about that program.
As you mentioned, we have a registered nurse who is a certified diabetes educator, and she does one-on-one counseling with patients diagnosed with diabetes. And then we also have a dietitian who can do one-on-one counseling and meal planning, which is really a very important part of it. I don't know about you, but we're all kind of picky about what we want to eat. And so she's able to take your likes and your dislikes and formulate a meal plan that will help you lose weight if needed, maintain the weight if needed, but essentially control your glucose through your diet. So we do that. We have group classes that are held, at different times of day throughout the month. And then I'm a nurse practitioner, and so I do assist physicians in our community by targeting patients with getting them on insulin and getting their blood glucose under control. We have a support group that's free. So if anybody's interested in any of these programs, we can give you lots of details by just calling our program at the hospital.
Perfect, Venessa. And I know you also partner a lot of times with the Lincoln Trail District Health Department, too,
Yes.
with diabetes education. So we really have a wide variety of resources here in our community for
We're very
individuals
fortunate.
with diabetes. I'd really like to thank you for being a guest, and I think our viewers, if they would like more information, can go to www.hmh.net or www.diabetes.org to get more information from the American Diabetes Association,
Certainly.
too. So thank you for being here today. We encourage you to talk to your healthcare professional about your personal risks for diabetes.